If you've got hip pain and you want to put an end to it, you've come to the right place. My name's Joe, I'm the founder and director at 𝗃𝗵𝗱𝗀𝗄 Physiotherapy, and what I'm going to show you today is I'm going to show you exactly how to test the hip joint and establish whether the pain you're experiencing is coming from the hip, and 4 very simple exercises that you can apply at home immediately to start counteracting this. Now, the most common symptoms of a hip problem include pain into the groin, pain into the front of the hip, pain that refers down the front of the thigh, pain into the bum cheek, or sometimes pain into the lower back. It is important to understand that not all hip pain is a hip problem. There are conditions at the lower back, for example, that can refer into the hip joint. So we want to differentiate whether the pain you're experiencing is a hip problem or something else such as a lower back problem. So I'm going to show you a very quick test that you can do at home to determine that. Now, one way that we can test the hip joint is to do a test called a Fadir test. And the way that we do that is we flex the hip, so bring the knee up towards the chest, and then keeping the knee up to chest, we come across the body, so we adduct the hip, and then maintaining this position, we bring the foot out, so internally rotating the hip. Now, if you're getting hip pain and you're doing this test and the hip is problematic, what you'll find is that there will be pain, discomfort or stiffness, end range, into the hip, into the groin or into the bum cheek. Now, if you're getting hip pain, groin pain, thigh pain, bum pain, you're doing this test, it's replicating or reproducing some of the symptoms around the hip and around the bum cheek, the chances are that the hip is causing those symptoms. And now I'm going to show you 4 very simple exercises that you can do at home to start counteracting that. Like with any new exercise program, please consult with a medical practitioner before trying any of these. So the first muscle group that we want to start strengthening is the glutes. And it's important to understand that the glute is what we call a triaxial muscle, which basically means it works in 3 different planes of movement, and we want to be targeting all 3 planes of movement. And the first exercise that we're going to do is a single leg bridge. The way that we do a single leg bridge is we find a hard surface, so the floor will be fine, and we're going to just do a single leg bridge on one leg. So please bend the left leg. We want the foot flat to the floor or to the bed. We don't want the heel too close to the bum because you've not engaged the glutes properly. So step out slightly, but again, don't go too far that you're picking up more of the hamstring. So foot flat to the floor, and then we're going to lift the opposite leg off of the floor, and by pushing through the heel, we're going to lift the bum up off the floor. So off you go, and hold. And when we get to the top position there, we just want to be holding it for 2 or 3 seconds and slowly controlling down. And again, and down from please. And a good starting point is 3 to 4 sets of 10 to 12 reps. And if that gets too easy, you can hold the isometric contraction at the top, so increasing that from 2 to 3 seconds to maybe 5 to 10 seconds. Okay, so the second glute exercise, which is actually my favorite exercise, is a single leg stand combined with hip abduction and external rotation. And this will hit the glutes through all 3 planes of movement. And the way that we do it is we take a mini band, step into the mini band and take the mini band and put it around the top of the knees. From there, I want you to stand on just your left leg, please, Sam. We want a little bit of bend in the left knee, and the right knee wants to be perfectly in line with the left knee. From there, we want to then take the hip into abduction and a little bit of external rotation. And what you'll feel is you'll feel the glute working on the right and the glute working on the left. Back in, please, nice and slowly. And again, back out. And back in. And with this exercise, you want to be doing relatively high volume, so reps of 15 to 20 and sets 3 to 4. And if it's getting easy at 15 to 20 reps, you want to be increasing the resistance of the band. So just work through a heavier band, and as you progress through the bands, you might just have to drop the reps and sets down a little bit. Now, the third exercise we're going to do is for the hip flexors, which is a large muscle group that sits on the front of the hip. And the way that we do this is, again, we do it seated. We want a nice hard surface. To start with, if you can get a little bit of back support, that'd be great. And I'm happy for you to use your hands on the floor or on the bed, whatever you're using, for a little bit more stability. As you get stronger, you want to try and take your arms off, but for the first example, we're going to do it with arms on. So from this position, what we're going to do is keep the knee fully locked, lift the leg over the kettlebell, touch down and back over again. And what we want is, we want that movement to be smooth. We don't want it to be up and then dropping it really heavy back over. We want that movement to be really slow and controlled. And as soon as that heel touches the bed, we start to come back over the kettlebell again. Just demonstrate 3 or 4 for me, please, Sam. Now, in terms of volume, we want the volume relatively low. So I'd aim for maybe 6 to 8 reps, 2 to 3 sets to start with. And as you get stronger, you can increase the reps and the sets, and also you can increase the height in which your leg's going over during the exercise. The last exercise is for the adductors, which runs on the inside of the groin. Again, it's a very important hip muscle. And the way that we start to exercise this muscle is in a seated position. We want knees to be in line with hips and feet flat on the floor. And then in this position, use a football. You might want to just let a little bit of air out of the ball. We place that between the knees, and then in that position, you're going to squeeze the ball with your knees, and we're going to hold that for 5 to 10 seconds. And relax. Now, a good starting point is relatively low volume. So 6 to 8 reps again, 5 to 10 second hold. And what would be better would be to increase the time in which you're holding the contraction as opposed to doing more reps. And you want to try and build that adductor hold, that adductor squeeze up to around 20-30 seconds. Thank you for watching the video. If you enjoyed it and you found it useful, please drop us a like or leave a comment. And if you want to watch more videos like these, please remember to subscribe to the channel.